Hey, welcome back to another segment of Let's Talk, and it's always a pleasure to be. We back in the studio today, and not outside playing around today. So, yeah, I figured we'd come back home and do a show here, and got beautiful guests here today with some good information. And let me welcome Dawn Jones.
Good morning, John.
How are you?
I'm great. How are you?
I'm doing fine. And Dawn, you're from the Department of Health of St. Lucie County.
I am, but I'm considered Area 15, which consists of Indian River, St. Lucie, Okeechobee, and Martin County.
And that's good for our viewers to know today because we have some great information. Dawn, why don't you tell them a little bit about what you do at the Department of Health? And everybody's always saying Fort Pierce, Fort Pierce, Fort Pierce. So let's clear up some of that today. Tell them what you do and what's going on in St. Lucie County and Fort Pierce.
Sure. Once again, I'm Dawn Jones. I'm the Area 15 HIV/AIDS Program Coordinator for St. Lucie, Indian River, Okeechobee, and Martin County. My responsibility as the HIV/AIDS Program Coordinator is to make sure that we have all the programs and services that are needed for HIV prevention as well as patient care. So that covers counseling and testing all the way to patient care. Another area is the consortia, the Care Network of the Treasure Coast. It covers the 4 counties, St. Lucie, Indian River, Okeechobee, and Martin. We are working towards the integrated plan, implementing all of the aspects of the 4 key components within Area 15. Test and treat, PrEP, PEP, routine testing in a clinical setting, community outreach, and messaging.
So Dawn, what I get a lot of when I'm up here doing the outreach or doing some education, the first thing I get is, hey, I heard Fort Pierce is #1 in the state. Can we clarify that today on who's #1, and that, also to let them know that Fort Pierce is just a part of St. Lucie.
Exactly. The stats were not Fort Pierce, it was St. Lucie County as a whole, and that's where people commonly make their mistakes, separating St. Lucie and Port St. Lucie. In 2006, yes, we were #1 in the black community, and 1 in 35 blacks were infected. However, we've made tremendous progress. Again, we've decreased the rates by 81.7%. We are no longer #1, and we're almost out of the top 20 counties. Miami-Dade County is #1 in the state of Florida.
So we go back to 2006. They said silence was deaf in the black community. Could you explain that to us?
Yeah, silence was truly deaf in the black community. There was a terrible health disparity in St. Lucie County. And it was so bad. I can remember back when I was in the surveillance program, when the information came out, 1 in 56 blacks were infected. It was offensive. People had that ostrich syndrome. They're placing their head in the sand. We tried hard to educate the community, get community involvement, get people tested and that sort of thing, and it kind of fell on deaf ears because of fear. This disease paralyzed St. Lucie County into fear, and that's one of the reasons why the epidemic was so bad. But I am so glad that we've made the progress that we have in St. Lucie to date.
So while we're talking, where does Indian River County fall in that, if you could remember?
Well, thank God Indian River was not in the top 20 counties, or I would have really been in trouble trying to fight this epidemic. Indian River was way down on the list. I'm not saying that the disease doesn't exist. Mm-hmm. Yes, it does. Just because you didn't make the top 20 didn't mean that you don't have an epidemic in the community.
Mm-hmm. And it's also good that the more people that get tested, the more we can have some type of an accurate statistic on what's going on. People don't understand that the numbers that you give are the people that have already been tested and diagnosed, whether they're negative or positive. So,
yes.
I can say, being during the Indian River County for the 16, 17 years I've been doing it, I think from the beginning, and now it has improved. More people want to get tested versus when I first started and they had to wait 3 weeks for a result to come. Now everybody's quick to do the 15-minute rapid test and get their results right now, not understanding that, you know, what if I tell you you're positive? Are you ready to receive that right now? But it's like a microwave. They want it done fast, you know. So more people, I can say, are getting tested here in this county, and I'm sure in the other 3 counties as well. How do you feel about the new test that we're doing now?
Well, I think that it's been a long time coming. That 3-week waiting period instilled a lot of fear. There was already, you know, that fear, shame, stigma surrounding HIV/AIDS, and I think that we, you know, the more we educate the community, the more we test, the more we offer tests and make people feel comfortable, they will continue to test. We don't want anybody to have any fears because, you know, if you test positive, there is care and treatment. Yes, it's another diagnosis, but it's a manageable one, just like any other chronic disease, you know, diabetes, hypertension. You go to the doctor, you follow his treatment recommendations, you take your medication if you're placed on meds, and you live your life. We teach people how to live.
You know, I want to also thank you because we got the test here in Indian River County before they even thought about putting it here, and because of you, I remember on one World AIDS event we had, you had made the announcement that they were bringing the rapid test here, and I know that some of my past events I would invite y'all up to see how more people got tested to get their results right now. And I believe when we started it was 20 minutes.
Yes.
And then they had another test come out for 15 minutes. You know, and I always explain to people, no matter how fast the results come back, you're still going through that window period of 3 weeks and 3 months. So it might not show up in that test you take unless you already have it, but it could show up in the 3 week, 3 month window period. So I believe a lot more people started getting tested when the Clearview rapid test was available. But why is it so important for people to get educated and get tested and receive services?
Well, first of all, you get tested, you get diagnosed, we stand a better chance of fighting the epidemic and decreasing the HIV incidence rates, meaning transmission to other people. For pregnant women, to know your status, it means that you go on treatment and you try and prevent it from transferring over to your baby, your unborn child. So it's vital that we control this epidemic and one day get to zero.
Is HIV a death sentence now?
No, it's not. Again, it's like any other chronic disease. It's manageable with medication and treatment. You just have to adhere to the treatment.
And so is this test available in other areas as well as St. Lucie and Indian River County?
It is. It is available in all 4 counties of Area 15.
And that's good to hear, you know, because some were still worrying about not getting it. And I guess by seeing the numbers come in and realizing that, you know, this is one test you can't do out in the car now. You have to have a mobile unit, or you have to have a registered facility where it's okay to do the testing. But I can remember I was doing tests in the car at the home. You know, people called me, can you come to my home? Because they feared coming to the Department of Health, or they got in the car and took the test, even though they had to wait 3 weeks. You know, they wanted to take that test. You know, we really don't want to take a test till something happens or we feel that something's happened.
True. Again, back to the basics, that good old-fashioned street outreach, boots on the ground.
And you know, it's good when you get out there. I mean, I have a time when I get out there and talk to the people personally and not just be riding in the car waving my hand, but I get out and I go sit under the tree. They're playing dominoes, you know, and having fun under the tree, and you just have to go. I've put in my schedule of events now where I just have to take it to the street, Dawn,
Yes.
because a lot of people that we really want to reach is not coming to a building.
Yes.
I've realized that, and I say, well, you know, why keep putting the money in the building and the people that we want to come is not coming? So I have to go out and I have to take it to them, and guess what? They appreciate it. They say, if you take time out to come out here to us, you know, we really appreciate this.
True.
Hey, we're going to hold that thought, and we'll be right back in a minute.